And now, Dental Bites, with the dental hygienists of Dental Post.
A lot lately about assisted hygiene. You know, this dental hygiene shortage is having a lot of offices really wonder, is there a way to maximize the amount of patients that we see in that hygiene department? So what do you guys think about that?
I think it's great if it's done correctly. I think it's terrible when it's done incorrectly.
So what does that mean, Allie? What's right? What's wrong?
I've done it both ways. I've had an office where it was done flawlessly, and obviously another office that it was not. So what makes it correct is, I believe, having an actual assigned hygiene assistant. You can't have the dentist and the hygienist share an assistant, or else, there's going to be a filling that's going to overtake your next patient getting their x-rays. Or
because we all know who wins in that battle, right?
Always the dentist, always doctor. Yes, and that was my battle. But if you have the proper help and the proper time still per patient, I think it can be a nice workflow, especially if your assistant, at my office, it would be the assistant would bring back the patient, update the medical history, ask, chief complaints, if they have one. If they were due for x-rays, they would do the x-rays. And then once that was complete, then I would come in, I would perio chart, do the oral cancer screening, do their hygiene. And as soon as that was done, they would come in and stand for the exam and the fluoride. But while I was doing the actual hygiene, the cleaning part, they were standing in for the exam of the patient I just finished. So it was a nice flow. But if that flow is broken in any way throughout the day, then it can turn into a little bit of a hiccup and a little turmoil. But it takes time to find a good relationship with the hygiene and hygiene assistant, and it takes time to build that flow.
Yeah, and I definitely think you have to have somebody who's very calibrated to your standards, right? As in that kind of realm, the hygienist is the lead clinician and is the lead clinician for that patient. And I don't know, maybe that might be a wrong term to use, but that's like, they're the lead clinician. And so you want to have faith and assurance that the assistant that you're working with does everything to the standard of care that is the quality that you expect. Not just any updates in your health history. Like, this is your health history that we have. These are the medications we had noted. Is that still accurate? Are you still using them for the purposes you said that you were using them for? Like, having that conversation with them, I think, is really important for sure. Like you said, Allie, if they're calibrated and working together as a team, it can be beautiful. Beautiful.
And that's what I hear as well, is you really have to work as a well-oiled machine and know exactly each other's moves and how you handle patients. And then it can work beautifully. But like Allie said too, same thing, the doctor's assistant calls out sick. That doesn't mean grab the hygiene assistant, because then you're just chasing your tail all day. And that just makes for a very long and hard day.
I think the only thing that I stay worried about, and Allie, I'd love for you to speak to this, is did you feel like a scaling machine? Like, you're going in, you're perio charting, you're scaling. You're going in, you're perio charting, you're scaling. As opposed to, I got to tell you, my favorite part of a hygiene visit, don't tell somebody, is not the instrumentation part. Mm-hmm. It's the talking part. Like, I really like that co-discovery with the patient. Did you feel like you still had that, or did you feel like you were like, boom, 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 boom?
A little bit of both.
Okay.
When I was in this specific office, I was very new to hygiene. This was my first 2 years in it. So I didn't have that comparison to a different type of workflow. So I didn't really focus too much on what I was missing, and more of just, this is how it's done, and this is, what I need to do. But yeah, there were times, especially the very busy days where everyone shows up, especially end of the year, definitely had a little bit of burnout at times. But overall, I did enjoy it. There were some perks with the type of office I was at too. It was a corporate office, bonuses, of course, with seeing more patients. So that did give a little more incentive to make it work. And, you appreciate at the end of the month a bonus. But yeah, it was a lot of draining a little bit after a couple years, which ultimately I did end up leaving after 2 years and haven't been back in an office that worked quite like that.
So Allie, I had a period of time when I was a guest hygienist temping at a couple of different offices, and one of the offices that I temped at they called it accelerated hygiene, assisted hygiene. And one of my struggle points with that was the transition, the handoff between me and the doctor, that being able to relay my findings and the things that I was concerned about, or the things that I think that the patient was doing well, that I really wanted to share with the doctor as well. That handoff was really a struggle. Did you find that after getting in the flow with it for 2 years, like you were able to have that kind of easy handoff? Like, was your assistant able to calibrate with you to be able to play telephone, I guess, right?
Yeah, no, if it worked out where I was in the right pass off, where the dentist came in as I was still in there, I was able to have a nice handoff and say, oh, here's my concerns, here's what he or she's doing great. But yeah, majority of the time I had, that white sheet of paper on the desk with the concerns written out, and maybe my assistant would repeat it to the dentist, but a lot of the times the dentist would just look at it and say, okay, so it looks like she's concerned about X, Y, and Z. So yeah, it wasn't a lot of times that face-to-face handoff.
I'm imagining you sticking a sticky note to the patient's forehead.
Look at number 2 distal.
Allie, what's really funny is in my brain, I was thinking, look at number 2.
It's always number 2.
It's always number 2.
Always number 2. Stinky number 2.
I feel like the patient is missing that interaction between you and the doctor too. And I find that interaction that the patient witnesses between the hygienist and the doctor is so important in treatment planning and building trust. If they see that you have a trusting relationship. So that I think I would struggle with not being a part of.
I don't know, Kim, I want to get on board with you. I really do. But I got to say, from a patient perspective, they don't know the difference between us and the hygiene assistant. They're girls.
The same. Yeah, exactly.
I love when they mistakenly call me Dr. Allie. I'm like,
that one's nice.
No correction.
Yes.
Yeah.
No correction.
No.
Can I have the dollar signs that go with that DR, please?
Yeah.
But not the dental school debt.
Yeah. We don't want that.
Yeah. The positive dollar signs, not the negative dollar signs.
Only the good. Well, Allie, that's awesome. Thank you so much for kind of telling us your experience with assisted hygiene. And I think, in this time of shortage, I think we will continue to see probably more offices giving it a try. So hopefully our tip for you guys, it sounds like, is if you're going to try it, make sure you have that dedicated hygiene assistant and you're well calibrated so that you can do it successfully, so that nobody burns out and the patients still get the best care.
Absolutely.
Yeah.
All right. Well, thanks for joining us for Dental Bites, everyone.